Sensory processing disorder, SPD, is a condition that affects how the brain interprets and responds to sensory information from the environment. People with SPD may be hypersensitive, overresponsive, or hyposensitive, underresponsive to stimuli such as touch, sound, light, or movement. For individuals with developmental disabilities, sensory challenges can significantly impact daily activities, including communication, social interactions, and personal care routines. Direct care staff who understand SPD can provide better support by adapting environments and interactions to meet each individual's unique sensory needs. Sensory overresponsivity occurs when an individual is extremely sensitive to certain stimuli. Common triggers include loud noises, bright lights, certain textures, or unexpected touch. For someone with sensory overresponsivity, everyday experiences such as wearing clothing with tags, brushing teeth, or hearing a vacuum cleaner can feel overwhelming or even painful. These individuals may react by covering their ears, withdrawing from touch, or displaying distress behaviors such as crying, screaming, or aggression. Caregivers need to recognize these reactions as responses to discomfort rather than deliberate misbehavior and adjust the environment accordingly. In contrast, sensory underresponsivity means that an individual does not register sensory input as easily as others might. They may not react to pain, appear unaware of their surroundings, or seek intense sensory experiences to stimulate their nervous system. These individuals might frequently touch objects, enjoy deep pressure activities, or have a high tolerance for extreme temperatures. Without proper support, they may not recognize potential dangers, such as not reacting appropriately to hot surfaces or sharp objects. Caregivers should provide structured sensory input to help these individuals engage with their environment in safe and meaningful ways. Some individuals with SPD engage in sensory-seeking behaviors, which involve actively craving sensory input. They may enjoy spinning, jumping, chewing on objects, or seeking tight hugs. While these behaviors can sometimes be disruptive, they serve an essential function in helping the person regulate their nervous system. Providing alternative ways to meet these sensory needs, such as weighted blankets, fidget tools, or movement breaks, can reduce distress and improve focus. Direct care staff should observe patterns in sensory-seeking behaviors to offer appropriate sensory input at the right times. Personal care routines can be particularly challenging for individuals with SPD. Activities such as bathing, hair brushing, or wearing certain fabrics may trigger distress due to sensory sensitivities. Caregivers should be mindful of individual preferences, use gentle touch, and introduce changes gradually. Allowing the person to have choices, such as selecting a preferred shampoo scent or using a soft washcloth instead of a rough towel, can make hygiene routines more tolerable. Understanding that resistance to these tasks is often sensory-based rather than behavioral can help caregivers approach situations with patience and flexibility. The environment plays a crucial role in supporting individuals with SPD. A cluttered, noisy, or visually overstimulating space can increase stress and lead to sensory overload. Simple adjustments, such as dimming lights, reducing background noise, or providing a quiet retreat area, can make a significant difference. Likewise, some individuals benefit from structured sensory input, such as deep pressure activities or calming music, to help them regulate their emotions. Caregivers should work with occupational therapists when possible to develop sensory-friendly strategies tailored to each individual's needs. Communication is essential when supporting someone with SPD. Some individuals may struggle to express discomfort in traditional ways, leading to frustration and behavioral challenges. Caregivers should pay close attention to nonverbal cues, such as body language and facial expressions, to recognize when sensory distress is occurring. Encouraging self-advocacy by teaching individuals to communicate their sensory needs, whether through words, gestures, or visual supports, can empower them to have more control over their environment and experiences. By understanding sensory processing disorder and its impact on individuals with developmental disabilities, direct care staff can provide more compassionate and effective support. Recognizing sensory triggers, offering accommodations, and fostering a sensory-friendly environment help individuals feel safer, more comfortable, and better able to engage in daily life. When caregivers approach sensory differences with patience and adaptability, they contribute to a more inclusive and respectful caregiving experience that prioritizes each individual's well-being and dignity.